Hello everyone, I'm Gabriel C. Welcome in Studio One. Today I'm going to share with you the process of making or writing a nursing care plan by student nurses. I will share to you vital informations and tips on how to create a good nursing care plan. Step 2. Nursing diagnosis. The second step of writing a nursing care plan requires data analysis in order to formulate a correct nursing diagnosis. Using the collected data, you will develop a nursing diagnosis, which the North American Nursing Diagnosis Association International defines as a clinical judgment about human response to health conditions, life processes, or a vulnerability for that response by an individual, family, group, or community. According to NANDA International, a nursing diagnosis is a judgment based on a comprehensive nursing assessment. The nursing diagnosis is based on the patient's current situation and health assessment, allowing nurses and other healthcare providers to see a patient from a holistic perspective. A nursing diagnosis sets the basis for choosing nursing actions to achieve specific outcomes. A nursing diagnosis is based on Maslow's hierarchy of needs, which identifies and ranks human needs and helps prioritize treatments. Remember that the subjective and objective cues must strongly support in the formulation of a nursing diagnosis. Let us take a look at this case scenario of John Doe, who had a gunshot wound to his right lung. In this nursing care plan, the subjective cue is "I can't breathe properly," based on John Doe's verbal statement. Furthermore, the objective cues are the following: respiratory rate of 30 breaths per minute, oxygen saturation of 85%, cyanotic lips, absent breath sounds of the right lung, chest X-ray of right hemopneumothorax, and an arterial blood gas result of respiratory acidosis. What do you think is the nursing diagnosis for this case scenario? Based on the assessment data gathered, we can formulate a nursing diagnosis of impaired gas exchange related to right lung gunshot wound as evidenced by low oxygen saturation of 85%, cyanotic lips, and respiratory acidosis. Nursing diagnosis has three parts: the problem, the etiology, and the defining characteristics. In this nursing diagnosis, impaired gas exchange is the main problem of John Doe. Related to right lung gunshot wound is the etiology or the cause of the problem. As evidenced by low oxygen saturation of 85%, cyanotic lips, and respiratory acidosis are the defining characteristics of the problem. Let us dissect our nursing diagnosis. I hope you learned something today on the second step of writing a nursing care plan, the diagnosis. The third step is planning, which will be discussed in the next video. And that's the way it is. I'm Gabriel C. Thank you so much for watching. Until next time, stay safe everyone.